WAVDXA listening. WJAD listening. Hey, how are you? You waiting for the net like I am? Yes, I am. I just turned everything on, did a microphone check, and sounded like everything was working. Turned on NetLogger, and I didn't see anything. So I don't know what's going on. I had to miss last week. I was visiting with my son in the Washington, D.C. area, and was spending time with my two grandsons. Couldn't quite make it to the radio. Yeah, I understand that. I've had that problem too. Yeah, I think probably people got what do you call, messed up with the time change. It's my understanding that we keep it at the same GMT as normal, so that means that those people who change their clocks would have to come in an hour earlier, so 10 o'clock rather than 11 o'clock. But maybe everybody else didn't do that. Maybe they're going to come up with 11 o'clock anyway. But we'll find out. Yeah, I'm pretty sure Jay mentioned they were going to keep, going to keep the Zulu time, UTC time instead of the switching to daylight savings because there really is no other interfering nets on at this time. So it, hopefully that was the case. This is actually a little bit easier for me. Both are okay, but we'll wait a little bit longer. If no one shows up, I guess we will come back at 11 and see what happens. You've been doing okay up there in the Northeast? We had some storms yesterday. It rained about an inch and three quarters, and we had some wind that was up to about gusts around 50 miles an hour. But in on Cape Cod, that's not unusual. It's a nor'easter comes up. We're supposed to get some more today. Right now it's sunny and blue sky and very, very, very comfortable. But we're getting in that time of the year where one day it's cold and the next day it's warm, hot. It keeps changing up here, and it'll be that way until sometime in December when it'll just stay cold. But we'll live through it. We always do. Yeah, it's pretty much true. Ohio usually stays cold right now, but it's been still going back and forth pretty well. Uh, when I drove back from DC, it was pouring rain. I don't know how much rain we got here in Ohio, but it rained for the last hour and a half of our trip very, very hard. It continued into the night. The next morning it quit, but we actually had some snow flurries this morning and a very light coating on, uh, just on things like lawn furniture and the barbecue grill, etc. Uh, and it's pretty well melted already, but we're not that far. Another week or two from now, if we have a system like this go through, yeah, it'll be the real thing. AA4FL here. Hey, Jay. We weren't sure if everybody got the message about you have to go back an hour with the time change and everything. WXA here. Yeah, good morning from WJP. Oh, good morning to both of you, Andy and Mark. Yeah, the time change got me. I was just going to jump in the shower and realized, hey, there's a time change. So sorry I'm a couple minutes late to start the net, but yes, 1500 is the time, and I should have sent out the notice to the listserv. But we'll start the net momentarily. Is there anybody else here waiting on the Medical Image Radio Council net? Make your call now. Kilo.
Good morning, Steve. Thanks for joining in once again this morning to all three of you, actually, for being here bright and early. I apologize for being tardy myself. I'm actually living out of my father-in-law's apartment here for this week. My kids have my place. I'm just all shuffled around. I'm moving three people to North Florida consecutive weeks and packing for them. So much fun, but it'll be worth it in the long run. Any other stations here for the Medical Image Radio Council DVNet? This is AA4FL Next, so we formally haven't started that. So go ahead and make your call now. Let me know if you're here.
This is N5RTF.
Well, thank you, Jeff. N5RTF. Good morning. Thank you for being with us. This is AA4FL. Net control for the Medical Entertainment Radio Council Digital Voice Net, which is held at 1500 UTC on Saturday mornings, every Saturday here local time. And, well, the time change confused me. I was a few minutes late, but we'll get used to starting at 10 Eastern now. And appreciate everybody that's already checked in. This a net of hams that are interested in health-related fields, whether you be a healthcare provider or somebody that's just interested in health health treatment. Well, let's drop one here. Okay, I see Merrill popped in here, WW6 AA. So glad to have you here. Thank you for joining us this morning. It's been a while, and get you checked in here, and appreciate you stopping by, Merrill, very early from California. We'll do check-ins in just a moment. So again, this is the Medical Image Radio Council Net that we do weekly, and we discuss about topics about health-related fields. And anyone's welcome to join in. You don't have to be a Medical Image Radio Council member. We encourage participation. However, if you're a guest and you don't feel like being involved in the roundtable and you just want to listen, of course that's perfectly acceptable. But consider checking in and just letting us know that you don't want to participate in the roundtable so that we can acknowledge that you're here, at least in the records. We have NetLogger up and running if anybody would like to see the 6 check-ins we have so far. I'm going to let it drop on. This is the AA4FL.
N3IM in and out.
Okay, Keith, good morning. N3IM. I understand you're going to be in and out. And if we don't get you at a particular time in the roundtable, we'll come back and check with you again. So, we will be taking check-ins. Just want to do a little housekeeping, remind everyone that on transmissions from the Quadnet Array, make sure you pause after the last person speaks. And, before you key up, give it a few seconds after you key up also, before you speak. Just get a chance to all the different servers and repeaters and the interconnected system, transcoded transmissions, everything needs to sync and harmonize. Just please do that. Are there any individuals with emergency traffic in the net? If so, make your call now. None heard. How about individuals that are mobile or only going to be able to be short term make your call?
KE0PVI, short time.
VE7BST, short time.
VE7BFDSP, go ahead.
A4FL, this is VE7BSP. Good morning to all on net. I've been seeing you key my hotspot, but I've not been hearing any audio come through. Is there a particular question or item that you're looking for this morning?
Yeah, I'm not sure what was going on here. Are you copying me now, Richard? Go ahead.
Affirmative, you're coming through now. And so just a question as to whether or not you had a specific question for us to consider this morning.
No, being that you were a short time, I want to give you an opportunity to make any presentation that you might have, Richard. VE7BSP AA4.
A4FL, VE7BSP, very good. Just a quick update as to what's going on here in Canada. We've heard several provinces move to mandatory vaccination in a number of different settings, particularly healthcare providers. There are a number of professions where we've lost staff because of choices of not getting vaccinated. And that's putting some additional pressure on our institutional system. We are starting to see the wave 4, at least here in British Columbia, level out in terms of incidence of cases. We're still cautious though, because in terms of finishing our opening up of the environment or the community in that to our final stages of reopening, because Christmas is just ahead of us, and we saw a little blip on the heels of Halloween of incremental cases. So we're a little bit cautious at the moment, but good to see that the borders open and between Canada and the U.S. And if people are taking precautions, make certain that one, they're vaccinated, but two, the PCR testing that is required to come back to Canada is available, and people are taking advantage of it. So back to net control, VE7BSP.
Well, thank you for the report, Richard. We appreciate you being here with us today, and look forward to your participation in a little while. And here, in the United States, I'm sure you're well aware of it. Is there a variance in the expression of infectivity across Canada in different parts of Canada? Well, VE7BSP, AA4FL. Richard, we across the United States, we have differing amounts of disease and infectivity rates in different locales. Some suggesting the fourth wave is starting. What about in Canada? Can you tell us what's happening in Canada in that regard? I mean, I don't know if I'm still being copied, but Keith and 3IM, are you with us? Go ahead.
This is M3IM with the group. I'm here. I don't have much to say at this point in time, other than the fact that the weather's been rather miserable the last 2 days. So we're getting the storm that was called for. So No snow, but it's cold and wet. This is M3. I am back to the group.
Well, thank you for stopping by and saying hello, Keith. I hope it doesn't put a toe damper on your weekend. KE0 PVI. Go ahead, Russell. Okay, nothing heard from us. VE7BSP, Richard, I don't know if you heard my question. I saw you pop in. Hopefully you're copying me. Go ahead. A4FL VE7 BSP. I heard a question around how we're doing with variants in Canada. I guess I didn't get through my transmission because I did attempt to respond to it. But yeah, we're still predominantly Delta variant, watching, the borders are starting to open and international travel starting to occur again. We're watching the other variants out in the rest of the world to see how they're performing or how they're behaving and what kind of risk we should be expecting here in Canada. And then my other comment was that we're intrigued about the antiviral therapies becoming available, although we've only seen press releases, we actually haven't seen the evidence yet. Back to net control. Okay, thank you. I copy all that. We appreciate the information. We go back to the top of the list, WJ8B. Andy, go ahead.
Well, good morning, everybody on the net. Yeah, here it's starting to creep back up again, at least according to the local news. My daughter is still very busy at her hospital, and there has been problems with not enough staff, people quitting. You have some traveling nurses, even some of them don't like to stay the entire time. As far as here, mostly I think it's the areas, rural areas where it's the worst, but it's everywhere. And it's not, it goes down for a period of time. One thing you brought up that I questioned about the new antiviral therapy. I've not heard a lot of reports on how that's being used, and if anybody's connected up to the direct care of COVID patients would know if that's being used in their location, that would be an interesting topic. So that's all I have this morning, Jay. Back to you from WJAB.
Yeah, thank you, Andy. We're planning the expedition in May to St. Martin. And a couple of our members do have some compromises. And one of them had expressed taking some sort of a cocktail that's supposed to give you 30 days coverage. So, in addition, because they hadn't zero people, we need to three two injections of boosters, so that's zero for due to their compromise. I don't know if the expedition or not at this point. Just has it next month. Apparently, he's aware of treatment was supposed to get 30 days of help. WA1EXA, Mark, go ahead.
At WA1EXA. Well, Massachusetts is pretty much the same as every place else. We are seeing increases across the board as far as both cases, hospitalizations, deaths are pretty much on equal par. There's not a very big increase with that. Our vaccination rate's very high. We're getting a lot of people now getting the booster, the third shot. That's becoming more and more common. We're just about got all the older people done, and we're getting into the younger people, and all of the issues that we're having is basically the people who are refusing and being fired from their jobs now, and that's causing, of course, a big political issue. as far as firing people, but the state's doing that, and so is just about all the employers now, the large employers, all the and municipal systems, and all the state government. So, and probably that's what everybody is seeing. So I would say it's the same thing with winter coming. No one knows what's really going to happen, um, but we're going to find out, I'm sure. And of course, Thanksgiving's coming up, as Richard said. We're looking to see how that's going to play out because of the travel, and everybody's moving around now and getting together. So I don't think that's any different than what everybody else is saying. So back to you, WA, what do you say?
Well, thank you, Mark. I understand everyone seems to be holding their breath to see what will transpire in the next month in Europe, parts of Europe that have not been vaccine receptive or going through an increased rate. So hopefully that won't be the case, but history is going to end up being the arbiter of what happens. But in the meantime, it's sure would be beneficial if people would get protected. Then go ahead to Steve, K3SDT, go ahead.
Thanks, Jay. Good morning, everybody. This is Steve in the Wissahickon Valley portion of Philadelphia. K3SDT. Yeah, I've missed some of the discussion. Not sure whether I've got a hotspot issue or what. But in any case, my spouse and I are very carefully watching the trends because we're going to be snowbirds again this year. We're flying to Hawaii in early January for a couple of months. And I'm very concerned about the early signals. I'm not sure what that portends. As to the antivirals, several of you have already made the most salient point. A lot of press release, no data. So that will get a certain portion of the public stirred up, but as a practitioner, albeit a retired practitioner, I'll wait for the data. Nothing else really to contribute amateur radio-wise. Things in the general neighborhood continue. One of the clubs is having in-person meetings, and I did attend and asked, and socially distanced. That's about it from me. Thanks for running the net, and I'll turn it back to you, Jay. AA4FL, this is K3FZ.
Glad to have you here with us, Steve. Everyone else is here. And Mark, thank you for running the net for me last week when I was unavailable to be able to EXA. All these fills in and the gracious effort there and effective effort. And it reports to me afterward what transpired, which I do appreciate. Yeah, I've been a little loose lately and spread in a number of different directions. So I apologize for losing a little focus and get back to normal after the first of the year. Actually. Jeff, N5RTF. Good morning to you, Jeff. Go ahead.
Well, good morning, Jay and Annette. This is N5RTF. Before I forget, we are streaming and we are recording. Terry and I are out in the swamp again this weekend, and I've been spending most of my time relearning how to fish. Caught a 2.5 pound catfish yesterday. Look forward to eating it today. So I hadn't done much radio work, and I've been pretty much uninvolved in the COVID arguments. My employer does require vaccine, and I lost a good nurse because of it. But aside from that, I haven't heard a lot of real problems. N5RTF.
Thank you for joining us, Jeff, and I wish you continued success fishing. What other species are in the waterways? I mean, do you get red that comes into that area? What else comes up there other than catfish?
Well, the catfish was sort of ironic because I could have caught that in Mississippi, where I grew up. But the big species down here, speckled trout, redfish, black drum. Redfish is a red drum. And then you have some sunfish that actually look a lot like freshwater crappie. So those are the things that we've been catching. Also, we got some crab traps out. We're getting blue crabs. Hope to have maybe a dozen of them this afternoon. N5RTF.
Well, certainly enjoy yourself and enjoy the food as well. And congratulations once again on the new QTH and the recreational and culinary opportunities that afford you. Your members to Terry, Government Law. That's AA4FL, net control for the Medical Amateur Radio Council, digital voice net. Before we proceed further down the list, are there any other stations that would like to check in, whether you be a member or just listening and you'd like to check into the net? Please go ahead and make your call now, AA4FL. No other stations heard. Merrill, WW6AA. Are you copying us, Merrill? Are you with us? Go ahead.
Yeah, Jay, I'm here. Fortunately, daylight savings time has occurred, and so I woke up in time for your net. And I 6 months, but I've been fairly active. I'm in Long Beach, California, so the news from Long Beach, California is there's only 111 ships now waiting to get into our port. And they just yesterday implemented a new rule. The ships were waiting offshore so that you could go to the beach and look at them. And they also were polluting the air of Southern California. So the new rule is the ships now have to wait 150 miles offshore, and they're being staged to arrive. The destination is, which means they may cross the ocean a little slower, and there'll be a little less pollution. As far as COVID, life in Southern California, or at least in Long Beach, looks pretty much back to normal. You are supposed to prove that you've been vaccinated to go into a restaurant, but other than that, things seem to be pretty normal. And the only other thing I would say is that because of my age, I lost touch with vaccinations, and one of my wife's friends came down with herpes zoster, and led me to the discovery that there's a new herpes zoster vaccine that's 2 separate shots. And my internist recommended, even though we had the previous vaccine, he recommended that we be updated with the new vaccine. So I'll pass that on to you guys, and I'll just sit back and listen. Bye.
Well, it's absolutely wonderful to hear your voice again and to have you with us, you know. With Europe opening back up, once it warms in the spring, are you planning on going back to Switzerland? Yes, we are going back to Switzerland. I'm going out. For those, if you want to follow my life, my father was a international magician's competition, which is held every 4 years, and now it's been pushed off to 6 years because of COVID. Will be in Quebec this summer in July. And so we're going to go to that, and then following that, we're going to take the Queen Mary over to Europe and spend the summer in Europe and Switzerland. My Swiss family came over here for the summer, and so life in Switzerland is actually better than life in the U.S. They're doing fine at this moment in time. Back to you, Jeff. Well, thank you for the report. Are there any other stations that would like to check in? This is AA4FL, the Mid-Atlantic Radio Council. Go ahead and make a call. All right, well, again, thank you, Merrill. Glad that you're planning some travel time. Certainly by the summer, it'll give us a chance to resolve or disclose any additional issues that might arise internationally. So we're supposed to be the last week of May, right after Ham convention, going to St. Martin and St. Martin. So not sure, not because I can't travel, but again, some of the group that we're going to travel with do have some compromise issues. So we'll watch it closely in discussing it. But certainly won't be able to travel. I was debating, I was actually planning on taking my father-in-law to a casino on Monday here in South Florida. So I don't know if that's a wise thing. He and I both have boosters. But he is 92, so we may have to give that a second thought, although the infectivity rate seems to be fairly low in South Florida. I'll double check. Let me take a rest for those of you that want to offer some input on the second call round. If so, go ahead and make a call to me. Just acknowledge that and I'll answer to his call. That's AA4.
What are you willing to say?
Hey, WA183, Mark, go ahead. AA4.
Yeah, I'd be interested. We tried something new last week, and I don't know anybody. I haven't heard any comments. We basically threw out a topic at the beginning of the net and used that as kind of a discussion point, and everybody kind of talked about it, but it wasn't. They had to. I mean, everybody can talk about what they want. But I'm wondering if that kind of approach is worked out, or what other people think about it, basically.
Hey, AA4, you just described it to me. Thank you for trying that approach. Any comments from those of you that were there last week participating in the net? Make your call, AA4.
WJB. And I don't know.
Okay, thank you for joining us, Howard. I'll check you in. Let's let Andy go ahead first. WJB, go ahead.
I wasn't here last week, right? The week before that, we did talk about that. And I think that's an excellent idea. The most successful, that's the ones that I have listened to for long periods of time. I guess to do that. And in particular, the digital voice net, which is a p.m. Eastern time. They just switched to daylight savings time. The E6TV and the group, probably the largest net on the Quadnet array, do that regularly. I listen to it in the Washington, D.C. areas on D-Star on 62 Alpha. Mark W84 set sets the tone for the topic to start at the beginning of each net. So I frequently myself have added extra topics to that net as well. The E6TV has a Facebook site that he announces the topic ahead of time. Not everybody has Facebook, but they don't know that, but he announces it clearly at the beginning of the net. We have our Google groups, which I use to get emails from. That would certainly be a way of communicating that as well. So that's my comments. I think it's a great idea. Back to you, Jay, from WJAB.
Well, thank you very much, Andy. Mark, would you go ahead and let everyone know what the topic was last week and how many people were involved in it? Because obviously not everyone was here last week that is here today. Go ahead.
WAWXA, sure. The topic last week was the effects of computerization on your particular practice or work or whatever it is that you did or you're doing, and how that affects the developing computation in their particular sphere of influence. We started talking at that when they thought that was worse than it used to be. So it was interesting. I think most overall was that people thought this was a better system, although it had some difficulties and some ups and downs. But that's what we talked about, and we had about 8 people, I think. I got to look back in the record. Either 8 people were on or 6. I forget. It was one of those numbers. WAWXA.
Well, thank you for starting that conversation last week. I wish I would have been here because it had a large effect on my practice and my professional activities. I started in the 1980s on the word processing end, moving into the front end of the office and the business office. When I got paper free and film free early in the 2000s, but in the 1990s, patients were rapidly adopting a receptor, and it helped with growing my practice. But I was a big proponent of putting a monitor in front of the patient, involving them in the discussions, and not hiding anything from view and explaining what they see in layman's terms. And it brought success for me, both from a communication standpoint and from an acceptability standpoint in terms of accepting treatment plans. Of course, there was no trickery there. It was just strictly communication for me. Anyway, well, I'm going to let it drop one here, but actually, let me turn it over to Howard and I don't know. Go ahead, Howard.
Good morning, Jay, and everybody on the net. My apologies. I thought I was coming in early, but I think I'm tracking in late and forgot we're sticking with Zulu time. I did participate last week, and I thought it was great. It was kind of interactive, moderated discussion, and it was kind of neat to hear the different perspectives that people with different clinical or research, whatever their aspects in the medical fields were, how they were affected and how we kind of all interacted. So it made for a pleasant net with a neat discussion. I think COVID will always be something that we'll have to periodically come back to, or at least in the foreseeable future. But it provided some relief from just the unrelenting rehash of the statistics off the news. So I think it's a great way to go, and I enjoyed it. I appreciate you guys doing it. Have a night all now. Again, sorry I'm on the night.
Well, Thank you for joining us, AA4FL Net Control for the Mid-Atlantic Radio Council, DVNet. I was a few minutes late myself. I was about to fall in the shower and have the realization of the time change. And that we were sticking to Zulu time. So, I think Mark and Andy filled in for me for a minute or two before I hit the air. I appreciate them doing so. And perhaps we'll have a few others join us as we get closer to the top of the hour, so we'll continue with the net here. I'm operating today from Delray Beach, Florida, with a different QTH than my usual, and seem to be doing okay with the internet here. We're 85 megabits per second here. When we're in Hawthorne, we're 12, and we have problems. But my Delray Beach QTH, my own, is gigabit speed. So I'm glad everything seems to be working here. And are there any other stations that we'd like to go ahead and have them turn in the line for a second go around? If so, please go ahead and make your call to me now, and we'll give you a floor.
N5 RTF.
N5 RTF. Just go ahead. This is AA4FL.
Yeah, I'd like to also compliment Mark. That was a good net last week. By the way, it is recorded and archived. So if you ever miss a net, either the digital net or the grand rounds, and want to go back and listen to it, on your drive to work or basically any time. They're all there, going back about 2 to 3 years, and I've still got another few gigabytes before I'm going to have to start trimming it. N5 RTF.
AA4FL Net Control. Thank you for doing that for us. It's an invaluable service. I've used it many times. I wish I would have listened to last week. Been here, there, and everywhere. I did listen actually for a few minutes and heard the conversation for just 2 or 3, and the wife had me shut it off somewhere. Well, we couldn't listen. Not being rude. I'm not usually the type that is that way. But we do appreciate everyone's involvement, having some new individuals here today. It's KE0PVI. Russell, are you around right now? Go ahead.
This is KE0PVI. Don't have much to say. I don't know what the topic's about, so I'm just sitting here at my desk reading some stuff about the new organization I just signed up for, and for radio communicating. And like I said, not much going on here. I'm from Kansas, so the weather's starting to change over.
Well, thank you for checking in and participating, Russ. Of course, you're always welcome to stop on by. And we're having some exchanges about the status of COVID in individual areas and talking about the topic of last week, which was with health providers, how computers have changed our practices or our businesses. And, computers, my gosh, Chip, I would never really let Chip talk about his computer background. I'd like to hear more about the early computer use, Chip. Over.
Roger on that. Well, like, talking about computers, I run a Windows machine for APERS, and then I run a Linux machine for my dashboard for my Pi-Star for VMR, and then I have a and both of those, well, one of my Linux machine is run off of a tower, but my Windows machine is run off of a laptop, Windows 10. So, and then I use UIView 32 for APRS over.
Oh, thank you for letting us know, Russ, what you're using. And again, many of us have been using computers, and it's nice to have them for image radio and for different purposes and different operating systems. The person in our organization seems to have the most experience going way back in the early days. Probably just in the late 1970s or early 80s. When were you involved there? N5RTF, AA for us.
I use both Windows and Linux, and I actually prefer Linux, but it doesn't have as many apps available as Windows. N5RTF.
N5RTF. Check with somebody that I know you did programming and back for the early days. When did you first start using personal computers? How early, and then when did you start adapting them for both professional or for image radio use? Correct?
Well, the first computer that Terry and I ever used was at Millsaps College. It was a PDP-8, which had 4K of memory and ran 4 users on teletype machines with punch tape as the storage medium. I remember the excitement when we got a 5 megabyte disk drive and were able to store programs on disk. But our first personal computers, mine was a Radio Shack, and then later we switched over to Windows just because of the utility in N5RTF.
Oh, this was Jim. I knew you were an early adopter. Mine was Commodore 64 was the earliest. I didn't use the TRS-80. Friends did. And, I remember getting the first disk drive for that after the audio tape as well. And I remember doing some early packet back then. Maybe some RIDI. This is probably the mid-1980s for amateur radio, before I was using a PC. Anybody else like to talk about their adopting of computers and amateur radio? We'll take a list, and we'll give everybody a chance to have an explanation of it.
WJP. And for DSC.
KD4 IZ.
Well, QSL, 2 additional check-ins, M4 and TSC, KD4 IZ. So, thank you for stopping by. I got confused about the time change, even though I'm the net control, and I was a couple minutes late. So you realize we're starting at 1500 Zulu for those of you that maybe had other things to do and just coming in, or hopefully wasn't intentional. But WJD, Andrew, why don't you go ahead and pick up the discussion for us? For us on net control.
I did use computers for amateur radio before I used it in medicine. I was familiar a little bit with the Track 80 and the Commodore 64, but never actually owned one son had a Radio Shack type computer. He used that a little bit at home back when he was a teenager. First computer I used for amateur radio would have been a Microsoft MS-DOS 8088. I had a 5-inch floppy disk, and I think I had a very tiny hard drive inside. So I had another fellow, him, ATSC, who was a database manager for Mac Tools, and he taught me the basics of how to do databases and all the MS-DOS commands and so forth. He passed away about 4 years ago. But in the early 2000s, I used that and then graduated up through the various Windows versions. Did not switch to Mac at home until about 2002 or 2003. So I did write with the aid of a programmer named Vince Teachout, who was located in Albany, New York. Electronic EMR was not a billing system or scheduling system, pure EMR. And we used and updated that on a regular basis for 10 years. And when it became obvious we could not keep up with all the federal and insurance company requirements, we switched. One of our main companies switched to ECW. I was very active in implementing the ECW, especially the first 2 or 3 years it was done. That was for the large group of 250 primary care doctors that I belonged to. And of course, I retired in 2018. Do still play with computers a lot. Play with it for media. I have Adobe Acrobat and Premiere and Photoshop and so forth, which we use on a regular basis. So back to you, Jay, from WJA.
Yes, Owen, thank you for the description. Quite a lengthy use for computers. The WebMD precursor was medical manager, and they bought them out. It was actually a Gainesville company, so I don't know how many medical people here were ever using WebMD or medical manager, but that was a Gainesville. Of course, I wasn't in medical field. They didn't have dental software. For me, it was a company in Charlotte, North Carolina, the MS-DOS days, and I tested. Back in the days of bulletin boards, you download a file versus an installation package or compilation. You wouldn't compile it, you just take the executable file you needed to try out, install it. So the history goes back quite a bit here too. Anyone else on that particular discussion thread? Make your call to me now.
N3IM.
And, hey, Jay, are you copying me all right this morning?
QSL Jack, I do copy you. Thank you for joining us here. I've got you logged in. N3IM, Keith, go ahead.
Okay, this is N3IM with a group, the A4FL, the Marco group. My first experience with computers was in college, and we used a punch card machine. That was my first course in computer programming. I went on to get a Commodore 64 and do some MS-DOS and machine language programming on that machine. And then for amateur radio, I started doing some APRS early on. The internet was not very big at that time, and I was mostly keystroke. So, but then APRS came along, and we used that for a little while. As far as the medical aspects, I've used several different programs because I was a traveling physician. Some were MS-DOS based and were actually terrible to work with. The Cerner program that we used at UPMC was a little more user-friendly, but there were several programs out there that were much more user-friendly than that. and I don't remember the names of them right offhand. And they can get you in big trouble if you're not careful, because you need to document just about every word down to, well, I'll see you later, because I've seen where people have been asked what they meant. My first office that I had Franklin. I had a 486 machine with a massive hard drive of 40 megabytes. Um, but I had to enter individually all the diagnostic codes into the machine, which took hours. But it worked fairly well for me. As far as amateur radio goes, I'm using a Windows machine at my station. The only Windows machine I have. And I'm running a number of different programs on that machine, including HRD, Grid Tracker, and N1MM, WSGTX, and a number of other programs. That's it from here. This is N3IM. Back to the group.
Thank you for the description, Keith. This is AA4FL for the Medical Amateur Radio Council. Digital voice set getting close to the top of the hour. For those of you that are just coming to check in, realize we started 15 minutes UTC, so an hour earlier with the time shift. But there any other late check-ins? Go ahead and make your call now.
This is N4TSC. I have some comments on the subject briefly. Go ahead.
Yes, thank you, Jerry. We look forward to hearing those comments. N4TSC, AA4FL, proceed.
Okay, AA4FL, N4TSC in the group. I'm sorry I'm late. Today happens to be the 5.7th anniversary of my 14th birthday. And so I'm getting all kinds of calls, and people are trying to connect with me, and so it's delayed me a little bit. So I just wanted to add to the comments that you were making about computers. My first computer was an Atari, and I never had any formal education about computers and never sought to do it. And it just happened that in the last couple of days, my Windows 10 computer started to slow down, so I decided to try to do a backup, and I used a system called ClickFree, but the manufacturer is no longer in business, and so I'm sort of flying blind at the moment. But I was trying to do a backup, and I started it at 8 o'clock last night, and I was monitoring it. It didn't finish till 4:30 this morning, so I'm a little bit bleary-eyed at the moment. But that's the kind of experience I've had, and I've used computers for medical work, for keeping track of billing and that kind of thing, with programs that were really convoluted and complicated, and that's been my experience. Anyway, those are my comments. Let me just turn it back to you, Jay. AA4FL and 4TSC.
Well, thank you. Happy birthday. Thank you for coming on, spending your special day here with us, and interesting hearing about your background. Most of us, of course, I know a few of us said here that they had punch card training in college, but in terms of the additional operating systems, I imagine many of us were experimenters and early adopters without formal training. So the MS-DOS years, of course, were a lot more difficult than they are now. The country many of those accounts with other operating systems are difficulty. But Windows sure changed life to make it more of a transparent activity. Hope you get your slow computer issues figured out there, Jerry. And I know Windows is getting ready for Windows 11 here shortly. Probably sending out some updates. Make sure to check the Windows updates. Make sure that it's not slowing you down as they transition. Anyone else have any comments about Windows and changes they've seen in the last week or two to updates? If so, go ahead and make a list. Make your comment on this AA4.
K3FZT, a historical comment.
K3FZT, go ahead, Stephen.
So I was sitting here listening to all my colleagues on the air recount their stories and nodding, remembering various aspects of my own. In the very early 1980s, we converted emergency department registration and lock keeping from a typewriter, a Selectric typewriter, to a Radio Shack TRS-80 Model 3 that was driving high-speed tape drives that were connected via the parallel port. And then through those tape drives to a dot matrix printer. And we generated the paper chart from that registration. And we captured all the emergency department log information from that registration and then from the entry after patient discharge, admission, transfer, or death. This was around 1982, 83. That was displaced a few years later by the hospital's implementation of a financial ADT system. A memory of a different time. 73, everybody. This is Steve in the West Mount Airy section of Philadelphia. K3FZT. I'll be clear about listening to till the end of the night.
Thank you, Steve. Have a great week. Look forward to talking to you again next week. These historical conversations are important, and unfortunately, we don't have any younger members here that are with us today that would put this in the context, because it's second nature to them. Those of them in their 30s, definitely, even in their 40s, just already grew up with computers in their profession and in their personal lives, and interact with younger individuals and the technologies that they use, the way they apply them, can be insightful for us. So if you have a grandchild or whatever they're doing education-wise, or if they're in college or lower levels of education, or just to observe the way they socially interact can be eye-opening. A lot to be learned from hanging out with them for a little while, seeing the world through their eyes. Anyone would like to report their experiences of experiencing the younger family members and the way that they apply their computer tools? AA4 phone control. Take a listen.
10-3 I.M.
I'm WK.
Hey, I'm Keith Miller.
N3IM AA4FL, are you still around? Are you having technical difficulties?
Someone look for WE1EXA in here.
I was asking if Jay was having any problems, technical. It seems to be dropping in and out real quick, and I'm not sure we didn't lose him. This is N3IM.
But thank you. I had actually just exited the program and came back in because I was having trouble there and accidentally closed the transmission prematurely. Wasn't sure when I had turned off the speaker keys. So thank you bring it back here. Go ahead, Andy, WJNB.
Well, yeah, the reason I missed last week was because I was with my 8-year-old and 4-year-old grandsons who live in the Washington, D.C. area. And they all use electronics to some degree. In fact, their parents restrict it because they're so drawn to it so much. The 8-year-old is doing coding, however, and can do QR codes on his own. And he visits a site from MIT called Scratch. And basically it uses a block form of Visual Basic to show kids how to code. And he's quite good at that. He loves it. And he actually goes formal classes for it. And we allow him about 30 minutes an evening. This was what he really unlimited. He would never do any of his other homework, but basically he's very much into that at a very, very young age. I wish I had a little bit of that. I had a little bit in high school, but the computer we had a limit of 16 commands and had something like 30 kilobytes of memory, something weird like that. But back to Renette from WJAK.
Well, thank you for that information, and I'll mention that to my children and my grandson 7, and for sure he would enjoy visiting that site and doing some coding. He's had one short after-school class in it. I'm not sure exactly what he's done. Now they're moving up to Gainesville, I'll be able to participate more in that. Any other stations that would like to comment on the subject matter? I think you're called AA4FL.
N3IM.
WE1EXA.
Okay, thank you both of you. N3IM, you go ahead first.
Okay, this is N3IM with AA4FL in the group. My great-grandchildren, one is in kindergarten and one was in pre-kindergarten, are very computer illiterate. It's amazing. They spent the last year on computer schooling, and they have no problem stealing their mother's phone and calling great-grandma, even to the point of using FaceTime. So they are very, very much into the computer age with their experiences at this point. One comment, there is nothing worse than being at work in the emergency room with all the young people around and the computers go down for 3 or 4 hours because nobody remembers how to use paper. This is N3IM, back to AA4FL in the group.
Yeah, thank you. Yeah. It is interesting. I didn't realize you're great grandparents already. Well, congratulations to both of you for multiple generations of enjoyment. WA1EXA, brother.
WA1EXA. I got a question. I've been trying to get involved with FTA, and in the past 2 weeks, more than that really, I've been trying to get my system to work. And so far, I've talked to technical assistants at Ham Radio Deluxe. I've talked to technical assistants at Tigertronics, who makes Signal Link, and they have not been successful. I'm still having problems. In fact, the Signal Link company is sending me another piece of equipment to replace what they sent me initially, because they said maybe it's not working right. I'm wondering if anybody else had a problem with that. I can receive, and I can read what's coming in, but you can't. The push to talk doesn't work right. It just either doesn't work at all, or it keeps clicking on or off in my radio. So just a question: if anybody has had that kind of problem, WA1EXA.
K3FZT.
WKV.
N3IM.
Okay, why don't you go ahead in the order that you just called in and addressing Mark's question for this day 8 question.
Mark, the Signalink operates push to talk by using Vox. It's not a true push to talk. It's puts the push to talk signal out based on the audio level. So there are two things you may want to do. You may want to reduce the delay just a bit, and you may want to increase the transmit, although I wouldn't do that if you're already up past halfway. I have no direct experience with the Signal Link. These are comments I've heard others make. K3FZT.
Okay, the next station with input, go ahead.
Okay, this reminds me of a patient asking a complicated question to a clinician like ourselves. It depends, okay? And that is correct. It does work on a box system. If you're using a older style radio and you're using your Signal Link, that's how you have to do it. And you have to adjust the box gain, etc., for the audio coming out of the computer to make it trigger transmission. And you have to do sometimes a lot of adjustments. You have to make sure that the jumpers on your are in the correct spots as well. If you're using an interface, for your microphone and for your Tigertronics Signal Link. Now, if you're using a more modern radio, then many of the newer radios, those built in the last 4 or 5 years, have a direct computer interface. And especially if they have an API, then none of that is needed. They have ways of doing that directly, but the instructions on how to do that really depend on the radio. I have a Flex radio. I still have a Signal Link because I used to use it on a 30-year-old Icom 761. Not using it presently, but I keep that as a backup rig. The Flex radio has an API program. All you do is just basically plug it into the computer and you're good to go. So you might want to comment after the third person talks on which radio you have. So back it up from WKAD.
Did you have some input as well? It is where
Yeah, this is N3IM and with A4FL in the group. Yeah, I think we doubled there for a little while, but basically I heard a lot of problems with single link and trying to keep them connected. I'm using a FTDX 3000 and it has a USB port in the back, but I found it's very important that you assign the virtual COM ports, the serial virtual COM ports, appropriately, because I had them mixed and it created quite a bit of consternation and stress trying to get things hooked up. But after I realized my mistake, it became very simple, and I was able to be connected. Again, I'm using a USB port on the back of my radio to my computer, which simplified things quite dramatically, other than the COM port situation. This is N3IM.
Okay, thank you for the input, Mark. If you got anyone to say, we'll be good helpful to you. Go ahead.
Yes, thank you for everybody. Just for your information, it is an older radio. I know the new ones you can connect directly. It's a ICOM 775 DSP, so it does not have an internal sound card. So I do need to have the interface. But the other things that were mentioned, as far as adjusting I knew Fox, but the adjustments may be off, and that is something that I got to check. I may have the either too loud, or well, it's probably too loud more than too soft. Too soft won't go off at all. But I'll check. I'll give that check and see what's going on, and keep working on it. I hope next week I can report that it's working. Thank you, everybody. WA with the X-ray.
Well, I'm glad our members get all of you input. Getting back to the subject we were talking about, the computers and such, and the evolution, some philosopher, well, I guess he's considered to be a philosopher, a professor, Hebrew University in Jerusalem, being interviewed, talking about humankind and the changes technology might impart on humanity. His name is Harari, Harari. So I don't know if he's got any YouTube videos, but if you get a chance to check him out, I think he argues that there's going to be a great impact on society on advances on humankind from technology and computers, which, of course, will evolve into AI, and he's even talking about the ability to have it integrated into our own neural pathways. So the future, speaking of the future, and the philosophical discussions and values that occur in the judgments that might be made. I think the one was on the self-driving car. The car had to, I don't remember, avoid an accident, but in the process of avoiding the accident, caused somebody else harm. What was the decision by the AIB? Because they're both improper outcomes in terms of probably as well rules of robotics. So just something you might want to look up. Yuval Harari, Harari, and perhaps we can talk about what you find next week on the manifest. AA4FL, we're going to close the call it metro close here, being it's already 16:20 UTC. An hour and 20 minutes into it. Do appreciate everybody being present today. It was a nice discussion group. And look forward to having Oh, I wouldn't say provocative discussions, but certainly engaging discussions on topics such as the one we just brought up. There's no one right answer. Hearing from a philosopher who's philosophizing on the index. There's a lot of trouble here. Okay, well, I'll go ahead and distribute that my listserv and maybe put a little summary and a link or two to what I can find, and we'll pick up on it next week as part of that. We talk about technology, humankind, and advances, and what it means for Homo sapiens as a species. History really talks about the evolution of Homo sapiens when we actually cradle. There's just not a whole new species of human, unlike what we're having now during instance. So to be all this day for us all hang around after bringing the next close. Thank you to Kwame Ray for looking and transcoding for us to make this possible. For element control, the Women's Radio Council TV calling the next close, returning to the amateur people. And standing by for people who like to say hello.
May we ever remember Hedy Lamarr for creating today's society. N3IM 73.
I second that. 73 guys, WA with the XA.
You piqued my interest. I've never heard her described that way. I remember some of what she had done technologically for the military. Something that you want to explain it to me, or too young and naive, I guess.
Frequency hopping was the beginning of the internet and cell phones and so forth. It was a basic thing, but it's progressed to what we have today. This is N3IM.
Yes, no, I was aware of that. Yeah, the big change in society. Yeah, this particular individual isn't just talking about society, he's talking about the actual evolution of the Homo sapiens physiologically due to these changes. It'll be almost like a whole new species here, a step above. Interesting when I saw the interview, but I didn't really get into the next lot of detail. So hopefully that's something we can talk about next week. Thanks for reminding us of getting along. AA for us.
N3IM 73 and QRT.
Well, I'm going to do the same. I'll say 7-3 and go QRT. I'll hang for just a minute if anybody else wants to talk, but otherwise we're going to go ahead and sign off. AA for us. Well, I think that's AA for us also. QRT.